everyone. Today I'm excited to make another video, and the topic today is going to be heartburn. And there are a number of reasons why I want to do a video on heartburn. The first being that I continue to see patients that are coming in with this symptom, and usually not as their primary concern, but definitely as a symptom that they'd like to see resolved in their body. The second reason why it's important to do this for me is that there's a lot of misinformation concerning the root causes or the underlying factors that are playing into this condition, and therefore a lot of misinformation about effective treatments. And lastly, heartburn is or results in millions of inappropriate and non-necessary prescriptions every year. Medications like Nexium and Losec, which fall under the category of proton pump inhibitors or acid blocking medications, are not only working against what the body is actually trying to do or communicate, but they're causing further harm to the digestive system. So I hope you find some of this information valuable and can apply it if necessary. So the first thing that I want to clear up is that heartburn is a symptom that is a reflection of a deeper underlying imbalance. It's not being caused by too much stomach acid. If you were going to see your doctor, like I was saying, what they'll do is they'll prescribe an acid blocking medication. They'll be under the assumption that this symptom is a result of too much acid building up in the stomach, but this is actually not what's happening in most cases. In most cases, it's being caused by a lack or an underproduction of stomach acid. And what's happening then is that there's a valve at the bottom of the esophagus, at the bottom of the swallowing tube before it exits into the stomach, that is not closing properly. So you're consuming food, it's getting down into the stomach, and then it's just splashing up into the esophagus because that valve or that sphincter hasn't closed. The signal for that valve to close is elevated stomach acid. So food comes into the stomach, your body wants to start digesting that food, it starts secreting stomach acid. That stomach acid signals the sphincter to close, and regardless of the level of acid, you are symptom free because no food contents can splash up into the stomach. So it's really important off the bat to realize that it's being caused by a lack of stomach acid, not an overproduction. And so based on this information, you can see why prescribing an acid blocking medication is actually making things much worse. In many cases it's helping with the symptom, but over time it's really exacerbating the problem. So I strongly suggest, if you are on an acid blocking medication, to work with a qualified healthcare practitioner to slowly wean off these meds. And the most common meds are Nexium or Losec, but they all fall under a class of medications called proton pump inhibitors. So another common cause of heartburn is a hiatal hernia, and all this means is that the diaphragm, which sits right at the base of the ribs, is weak in one area, and the stomach, which sits right under the diaphragm, is just sneaking up and causing a protrusion or a hernia in the diaphragm wall. And this irritates how that sphincter at the bottom of the swallowing tube can close properly. So many of us are walking around through our day with a really tight diaphragm, and it's often way up in the chest. And what we want is we want to relax the diaphragm, get it back down below the ribs so that it stops irritating that sphincter at the bottom of the esophagus. And usually the diaphragm is tight for one reason, and it's connected to our breathing pattern, how we've conditioned ourselves to be breathing. And so many of us will breathe up with our chest. And what we really want to do is focus on breathing down with the abdomen. So on an inhalation, the abdomen comes out, and this allows the diaphragm to drop. Um, so in addition to the imbalance with stomach acid, a hiatal hernia is often aggravating the heartburn symptom. So instead of relying on a harmful acid blocking medication, um, there are really simple, effective, natural treatments for this symptom. One of the first things that I find with patients is that it's essential to stop all coffee. Typically, once they remove coffee, the symptom um, resolves completely. If this doesn't work, then I usually suggest removing things like chocolate or wheat, corn or dairy. These are all food allergens that will cause tension around the diaphragm and the stomach. So the first suggestion, if you have this symptom, is to remove all beverages except water. Just drink water. A little bit of peppermint tea can relax the stomach, and that would be okay, but for the most part, just stick with water, and 99% of the time this will clear the symptom. If this doesn't, then you want to look at ways of building up the digestive power of the stomach and digestive system. A digestive enzyme with hydrochloric acid is really effective, and a professional line probiotic is also excellent because it builds up the good bacteria in the stomach and can help balance the acidity. So those are some really simple ways of treating this symptom. I think the take-home message is that these medications that are commonly being prescribed are ineffective and harmful and working against what your body is actually trying to communicate with the symptom. That heartburn is caused by low stomach acid, not high, and that there are really, really effective, simple, natural treatments. So I hope this was helpful in some way. If you have any questions or follow-up comments, please leave them at the bottom of this post, and I'll be sure to get back to you. Thanks.